Welcome, everyone. I'm Assemblyman Angelo Santabarbara, and I'm honored to be here with representatives from the Cancer Services Program of Fulton, Montgomery, and Schenectady counties. The Cancer Services Program is here with me this evening to talk about the services they provide that marks June as National Men's Health Month. The purpose of Men's Health Month is to bring awareness to preventable health conditions and diseases while encouraging early detection and treatment for illnesses such as cancer, heart disease, and depression. This month is also about encouraging men to take preventative measures before disease develops or becomes serious, such as cancer screenings, eating a balanced, nutritious diet, and exercising. But don't just take my word for it. I'd like to introduce our guests who are professionals in the field. Suzanne Hagedorn, Program Manager of Cancer Services Prevention of Fulton, Montgomery, and Schenectady counties. Tammy Lopez, Program Managers of Cancer Services Prevention of the Greater Capital Region. And Leslie Montanero, Health Education and Promotion Coordinator for Cancer Services Prevention of Fulton, Montgomery, and Schenectady counties. So Tammy, you'll be the first to kick us off, so take it away.
Okay, thank you so much. Thanks for taking the time today to let us talk about the Cancer Services Program and men's health. I'm going to give some general information about the Cancer Services Program, and I'd like to start by just saying that the Cancer Services Program, excuse me, is a New York State funded program, and it covers all counties of New York State. So any place, wherever you live within New York State, there is a number that you can call and they will connect you to the program that serves your area. It's a program that provides free breast, cervical, and colorectal cancer screenings to people who don't have health insurance or who have what we call underinsured, who have health insurance, but they have some type of a barrier to getting their cancer screening. So in order to be eligible for the program, you need to be a New York State resident. You need to meet our age eligibility, which I'll go over in a moment. You need to have no health insurance or be underinsured, and or be below 250% of the federal poverty level. Or if you're above 250% of the federal poverty level, you need to have a barrier to getting your cancer screening, such as being underinsured and not being able to afford your copay or deductible. As I mentioned, we provide breast and cervical cancer screening. So for breast screening, that is for women ages 40 to 64. We provide a free clinical breast exam and mammogram. If someone is under the age of 40 and we can still enroll them into our program, they would need to be seen by a clinician and have a clinical breast exam that they would be responsible for paying for. But if there is a finding of mass or they meet certain criteria for a family history, they can be enrolled in our program for their diagnostics. And I want to mention too that not only do we cover screenings, breast, cervical, and colorectal cancer screenings for people, but if there is a finding that requires further investigation and diagnostics, our program will pay for those diagnostics as well. So we also, as I mentioned, cover cervical cancer screening for the ages of 40 to 64, and that includes a pap smear, pelvic exam, and HPV testing. We do cover, I mentioned, colorectal cancer starting at the age of 50, but I'm not going to talk about that right now because I know one of my colleagues, Leslie, is going to do that. If you need to find a cancer services program in your area, you can go to www.health.ny.gov. You can search cancer and it'll take you to the Cancer Services Program where you can look and see what the program information is in your area, or the number 1-866-442-CANCER. Or 2262 will also connect you to someone, an operator who will connect you to the Cancer Services Program in your area. So I'd like to now turn it over to Leslie, who's going to talk to you some more about colorectal cancer screening and men's health.
Thank you, Tammy. My name is Leslie Montanaro, and I am the Health Education Promotion Coordinator for the Cancer Services Program, Fulton, Montgomery, and Community and Schenectady counties. I think we are, since we're focusing on Men's Health Month, colorectal screenings are just the first thing that kind of pops into my mind, because that's kind of what I do. I educate on those things. But there's a lot of details that I think a lot of men don't realize. There's a reason that we're kind of pushing that information and making sure that the men in our lives are getting out there to get their screenings done. Colorectal cancer is the second leading cause of cancer deaths in New York, and it's preventable. It's completely preventable. If you get your screenings when you're supposed to get your screenings, if you talk to your doctor about what kind of interval you should have, whether that's a yearly kit, and your doctor can recommend what you need to have done. If you don't have any other symptoms, if you don't have any reason to think that you are at an increased risk, maybe you can do one of those take-home kits or an in-office kit every year instead of doing a colonoscopy. But if you do a colonoscopy, you might only have to do one of those every 3 or 5 or 10 years, depending on, again, what your risk factors are, what your lifestyle is. That's a conversation, though, you should have with your doctor. Talk to your doctor about when your appropriate interval is and what you should be doing for that. There are things that can raise your risk for colorectal cancer as well. Your lifestyle, family history. In particular, if you have a personal history of ulcerative colitis or Crohn's, that will raise your risk as well. And that might put you into a category that does need colonoscopies. But again, talk to your physician about that. Talk to your primary care physician about that, or your doctor about that. If you'd rather not do a colonoscopy and that's keeping you from getting screened, I can tell you that one of our gastro doctors told me specifically, the test you do is the best test. So if what you want to do is a take-home colorectal screening kit or an in-office screening kit, do that and talk to your doctor about that. Do what you need to do your screenings. There are plenty of other kits out there as well, not just those take-home kits. There's different kinds of take-home kits that you can use. We offer a fit kit to take home. If you don't have any increased risk, or you're not symptomatic, you don't have any issues that would indicate you might have a problem, we offer free take-home kits through the Cancer Services Program. If you're uninsured, you can certainly ask your doctor about those as well and maybe get one to take home. All men and women over 50 should get colorectal cancer screenings, all men and women over 50. We cover men and women from 50 to 64. Generally above that, you have a type of insurance that would cover it. Again, if you have a family history, we generally can start screening, usually with family history 10 years before the youngest person in your family. So if you have family history of colorectal cancer, that's absolutely something to consider and should push you in the direction to get your screenings done, because it's absolutely so important. Things that you can do to lower your risk, so you can maybe cut back on your alcohol consumption if you do drink, get regular exercise, eat healthy, eat a diet with a little bit less red meat. Don't smoke. If you do smoke, quit, because that's just terrible for you anyway. So if you do smoke, quit, and try to just live a healthy lifestyle. That'll decrease your risk and keep you around a little bit longer, hopefully. If you have any questions or you need more information about those kits, or if you're uninsured and you'd like to find out how to get one, you can contact the Cancer Services Program. There's one of us in every county in New York, and we are all happy to help. And I am going to turn it over to Suzanne.
Okay, thank you. Leslie gave some great information, and Assemblyman Santa Barbara, we appreciate you taking the time to meet with us and to do this today, because men's health is important, and we know how much you support our program and the work that we do. And it's great to always get a male perspective on these things. So I think that'll be a little bit of our conversation maybe in a little bit. And I think that we, everyone who's listening or watching will be able to take that and, roll forward or move forward with it. So, we're coming to a close, obviously today, it's June 30th on Men's Health Month. And, the month is here to create awareness, to heighten awareness, whether it's women or men paying attention to the information we're sharing today. So, the women in your lives or your children are always wanting you to stay healthy and take care of yourself as well. So Leslie did mention, a lot of those great things that you can do, to be healthy, exercise. Assemblyman Santa Barbara, you mentioned some of those things as well. Getting your cancer screenings, eating right. So those are big pieces of that. And also another piece is the prostate exams and awareness for men. We don't screen for prostate cancer in our program, but we do provide assistance if someone is diagnosed with prostate cancer. And I think Leslie will talk about that a little bit in a few minutes. And, there is a test for that as well. And it's a PSA test, which is a prostate specific antigen testing. And, needed if you're 50 or older, if you have family history as well. I have a friend who gets tested every year because his father had prostate cancer. So that's another piece of that. And I think that all of our programs, we are always working in our communities to make sure that we are serving those people who need us most. And as Tammy mentioned, we're talking uninsured and underinsured, and those underinsured could be somebody with a high deductible or a copay. So kind of want people to understand that that's part of it too, and that it's just not if you don't have health insurance. So we really try to take a look at cases and make sure that we can help those individuals as well. So, and I'm going to pass it back over to Assemblyman Santa Barbara.
Yes, thank you. And really insightful information. And I think that everyone listening in, as you said, I think learned a little something today. And it's great to see that there's resources out there for people that want to learn a little more. But the important thing is taking the time to learn about these issues can make all the difference in the world. And each of you have made some great points and highlighted some very important statistics and issues and things that we can all do. And it can make a difference for yourself, but also for your loved ones. Keep in mind, we have families, and it's important that you take care of yourself, because you're taking care of yourself, you'll be able to take care of your family as well. So in summary, some of the helpful tips that I've learned that I want to share with the listeners is, number one, be sure to schedule an annual physical exam with your doctor so you can check in on your health. That's very important to do. I know we're all busy and we feel like we don't have time to do this, but it's important, and it should be important. You can catch early signs of serious conditions or diseases, and that makes all the difference in the world, as we've said. Number two, men should make sure that they're not overlooking or avoiding a prostate exam. A blood test for specific antigens is also available for this, as we heard earlier. Number three, men 50 years old and up should begin colorectal health screenings, or sooner if you have a family or personal history of colorectal issues. So that's very important to know your family's history, but also the resources that everyone just mentioned today, that you can do this. There's services available out there. There's no reason not to do it. So last but not least, I'd like to turn it over for final comments to each of you. And I want to thank you for inviting me to do this. I think it's an important informational piece to put out there for my constituents and for all men that want to learn more about how they can stay healthy. And I want to thank everyone that joined us today for this forum. So I'll turn it back over to each of you for final comments, and ask everyone to do your best to stay safe and stay healthy.
Thank you. Thank you again. I just would like to say, I just want to reiterate that what we've been saying, that colorectal cancer is one of the most preventable cancers out there, and that if you are an uninsured person over the age of 50, our program can provide you with a free fecal take-home kit. And if you are over the age of 50 and you have health insurance, it's just as important to make sure that you get to your doctor to have your colorectal cancer screening. and that men really need to take care of themselves. As everybody's been saying today, men generally put things off. They're busy doing other things and taking care of their families, and they tend to not take as good a care of themselves. So it's very important to make sure that they get those physicals scheduled and make sure they're up to date on their preventative screenings.
And it's really not that bad. That's what I would like to say. I've had a colonoscopy twice. I've gone through the prep. People are always worried about the prep. It's really not that bad. So to save your life, and like Tammy said, preventable, curable, treatable at the end of the day. So just do it. I say that all the time. Leslie, did you want to share a little bit about our Medicaid treatment program, just so people
So,
know after
yeah.
the fact, if there is a diagnosis, we do have something else to help them?
We do. If you're coming through the Cancer Services Program and you're being screened for colorectal cancer or breast or cervical cancer, if you're diagnosed with a precancerous treatable condition or breast, cervical, or colorectal cancer, you can enroll in the Medicaid Cancer Treatment Program, which is a Medicaid program, obviously, provided through the Department of Health. There is a designated qualified entity which can enroll you in the MCTP program at each of the partnerships for Cancer Services Program throughout the state. The MCTP program provides coverage for treatment for whatever cancer you have. It also covers prostate cancer, even though we don't screen for it. It does cover prostate cancer, but it covers everything. It's not just the treatment. It covers everything. It covers eye. It covers dental. I don't know if anybody has known anyone who's been in treatment, but those things are generally affected when you're in cancer treatment and you're having chemo or you're having radiation. Sometimes those things are affected. So this Medicaid covers everything, and is specifically designed to get you through your treatment. So you can't put it off. You have to have that screening done.
Mhm. And I'm going to add one last comment, and it is that men get breast cancer too. So, men have breast tissue just like women do. You could have a lump, you could just have fatty tissue, which could lead to you wondering what is going on. So at the end of the day, men can get breast cancer too, not a large population, but I always wonder if men are really paying attention to that. So just a thought. I have a friend who has breast cancer. He's a man, he's on round 3, and he's gone through the whole process. So it's an important factor as well.
Suzanne, can I just give the number one more time before we close?
Sure, yes.
So if anyone is interested in reaching out to one of our cancer services programs across the state, you can call 1-866-442-2262, and an operator will connect you with the cancer services program in the county that you live.
Perfect. All right, Assemblyman Santa Barbara,
Great.
back to you.
Yes. Okay. Again, I want to thank all of you for inviting me to be a part of this. I think it's very important to get the message out, and I hope we've done that. And I hope that people will follow up and get more information if they feel that they need it, and know that these resources are available. Certainly, you're all doing a great job, and the program is doing great things in our community, and that's why I support the program. And I was anxious to be a part of this, to get information out to my constituents. And as you said, sometimes it's easy to forget or easy to put it off, but we're here to remind you that you shouldn't put it off. And these are conditions that can be treated if you get the proper information and you see your doctor regularly. So I want to thank you for sharing the information with my constituents, and we're gonna share this information hopefully to all men that are listening in today. And the other thing is, one of the things we've learned through the pandemic is we need to help one another. We need to look out for one another, and we can do that here too. And if if it's a father or a grandfather or a friend, we can also encourage them to do it. And as you said, Suzanne, it's not that bad. And if you've gone through it, it's okay to talk about that and to encourage others to do it as well, and to get on a regular schedule, because it can save someone's life. So I want to thank everyone that was listening in today. And I hope that you will stay in touch with the Cancer Services program. And I know we'll do our best to get the information out there. So thank you all for joining us. Thank you all for being a part of this. And again, stay safe and stay healthy, everyone, and we'll talk again soon.
Thank you. Thanks for having us.